the allergies and infections, it may even complicate more this slide. So this slide will be more complicated if we include allergens and all the infections which are more prevalent in indoor. 2 or 3 important components are basically perfluorochemicals and BPA and phthalates. So phthalates in the indoor environment, phthalates, BPA, bisphenol A, and perfluorochemicals are the important chemicals that are implicated in environmental injury. So we will discuss their mechanism. Now BPA and phthalates, basically phthalates are they interfere with the hormonal functions, so they cause hormonal diseases. Now there is a hypothesized link between some of these diseases like decreased sperm counts and motility, increased male birth defects, increased testicular, prostate and breast cancers, abnormal weight gain, insulin resistance, diabetes, excessive mammary gland development. But there is no proven mechanism, there is no proven link between these diseases, although these diseases are more prevalent and they are documented, their prevalence is documented, but the link between these chemicals and these diseases is not. The reason for this is that we are so much surrounded by these chemicals that it is very difficult to identify the cause of which disease is caused by what. As if it is as we are swimming in a sea of toxins. Everywhere there is a toxin, and there are so many confounders: age, gender, sensitivity, genetic makeup. So it is very difficult to establish an exact mechanism, but these diseases have been seen and linked with these indoor chemicals, phthalates and PBA. Now perfluorochemicals is again hydrophobic and hydrophobic chemical that is used everywhere, like for polishing everything, and it is basically associated with developmental abnormalities. So it is more important for children. So there is a number of chemicals which are implicated in causation of these diseases, but exact mechanisms of only a few are well established and well known, while others are only epidemiological links. There are links, but these are more epidemiological rather than more mechanistic. So BPA and phthalates are important in indoor environment, and so is the PFA. So among the metals, now we turn to the metals. Metals, there is a long list again, but the common ones are lead. You all know about that. Arsenic, yes, yes. So these 4 are important. We will take lead. We will explain it in somewhat detail. Others are similar. What is the source of mercury? Thermometer. Fish. So you eat mercury by fish. So what is the source of for fish? So it somehow there are some examples of contamination like oil. So somehow this gets into the food chain. Now this mercury gets into the food chain, although it is not a part of a normal food chain, but it gets into the food chain and its concentration increases 1,000,000 times in some types of fish. So it is the fish, and the most common abnormalities associated with the mercury are poisoning. But what are the effects? That's diarrhea, headache.
Gray syndrome.
Again, it is more of developmental. It causes more developmental abnormalities. So they are. There is a special caution for pregnant ladies that they don't use much of the fish. So fish can cause disease, can transmit disease, can cause disease to the pregnant females, to the newborns, and this will then cause developmental abnormalities. And what about arsenic? Arsenic is, source of arsenic is soil and water. The source of arsenic is soil, and it can contaminate. The mechanism of injury is it interferes with arsenic. Interferes with arsenic. The mechanism of injury by arsenic. It interferes with the oxidative phosphorylation. Basically, it blocks mitochondrial oxidative phosphorylation, and thus it causes cellular injury and diseases. But more importantly, which is more prevalent, is the lead poisoning. And now, what is the source of lead? Paints and petrol. So paints, petrol, spray paints, and many things, they can be a source, and children are at a greater risk because they eat basically paint flakes, number one. Number two, they absorb more. Whatever they take in, they absorb about 50% of that, while adults absorb only 15% of that.
50%.
So adults absorb only 15%. Children absorb up to 50%. Number one. Number two, the immature blood-brain barrier permits the entry of lead to the brain. So again, the injury is related with the neurological abnormalities. So what are the diseases caused by? Some crowding here. Yes.
Usually these usually have indication before it reaches the level of really serious situation. So why do we focus a lot on this since there's symptoms before the actual symptoms?
No. The symptoms don't appear. Basically, the symptoms appear late in the course, and most of them, because most of them affect the developing newborn or fetus or infant.
Like in adults, sometimes with lead poisoning, you can see it appears in fingernails. Basically, you can just use it.
No. It does not appear early in the course. The symptoms of lead poisoning appear late, but the adults are not the main target of this, are the main victims of this injury. It is the children which are the main. They are the children which are the main victim, and in the adults it is basically memory loss, headache, non-specific symptoms. So very non-specific. So you cannot diagnose on that. In children, encephalopathies, mental retardation. In adults, it will also cause peripheral neuropathies. Again, very non-specific symptom. So they are very difficult to identify. The symptom of lead poisoning are so common, so non-specific that they are not easy to identify earlier in the course unless you have experience and you have very high clinical suspicion. What is the diagnosis? We will discuss in this case. What is the diagnostic method? Now, they form a lead line, a pigmentation of the gingiva. So lead cause basically pigmentation of the gingiva. It cause anemia. Anemia, how?
By destruction of the bone marrow.
Competition with that. Hemolysis.
It causes
Hemolysis.
It causes hemolysis. Yes. It causes.
Hemoglobin.
Okay, we will discuss it in a bit detail. So anemia is a feature of, again very non-specific. So anemia is a feature. And now peripheral neuropathies and kidney damage, the DI and tubulointerstitial nephritis is again, and abdominal pain. And this lead colic is a very severe abdominal pain because it interferes with the calcium functioning. And another thing is the bones, because it functions, it interferes with the calcification, so it interferes with the cartilage remodeling. It interferes with the remodeling of calcified cartilage and especially on the epiphysis. So it causes a radiodensity in these people. So what is the cause of anemia? So coming back to the anemia. So it interferes with the enzyme function. Lead interface with the enzyme function. It inhibits the binding of iron into the heme. Instead, this iron is bound to porphyrins. And it will cause, because it is a functional iron deficiency. It is not a actual iron deficiency. It is a functional iron deficiency. So anemia will be microcytic hypochromic. Whenever there is iron deficiency, the anemia will be microcytic and hypochromic. And other effect of this lead poisoning is that it inhibits sodium potassium ATPase. When it inhibits sodium potassium ATPase, because of it interferes with the enzyme activities. So it causes weakness in the cell membrane, cellular swelling, and ultimately cell lysis. So it is both a deficiency anemia, functional deficiency anemia, and a hemolytic anemia. So it is so, and the mechanism is, and so how do we diagnose? Now we can diagnose it with high suspicion if there is this is. What are these cells? RBCs. This is slightly enlarged cells with. This is blue darts. These are blue darts, and it is called basophilic stippling. Basophilic stippling on the smear. Basophilic stippling. This is these cells are basophilic is stippled, and this is the remnants of RNA. So RNA remnants impart a blue tinge to the cells. So this is basophilic stippling. And the second important thing is the X-ray, because it interferes with the cartilage remodeling. It increases the radiodensity of the margins of the bones. So this is elastic cartilage, and it is the increased density. So the diagnosis is very difficult. You should know about the basophilic stippling. You should identify this radiodensity at the margins and increased level of these protoporphyrins in the blood. So if the levels of these protoporphyrins are increased, then it is lead poisoning. Yes.
There are, like you just mentioned, some specific symptoms for lead poisoning, like the lead lines in the gingiva and the X-ray and the blood smear. So we can easily identify lead poisoning.
We can, but if we know that, because commonly we do not focus on basophilic stippling. When we see, you must have seen hundreds of you still have not seen, but during your rotation you will see hundreds of CPC without any mentioning about something like basophilic stippling. So you only this is not. It seems very specific over here, but on the slide it is very difficult to commit that this is basophilic stippling.
Okay, but
because
the X-rays.
X-rays, yes, you can make a diagnosis. I understand your point, but it is the symptoms are very non-specific. Although these are the tests you would request if you suspect lead poisoning. Okay. So go ahead with. So lead poisoning is important. Its mechanisms, a role in anemia, a role in cartilage remodeling, and its sources. Why it is more important in children. And the effects of tobacco